Welcome to this essential guide explaining stroke, also known as a cerebrovascular accident, covering its types, symptoms, and critical management strategies. A stroke is a serious medical event caused by a disruption of blood supply to the brain, leading to rapid onset of focal neurological deficits. A stroke involves symptoms lasting over 24 hours or leading to death. If the neurological symptoms resolve spontaneously within 24 hours, it's classified as a transient ischemic attack, or TIA. Strokes are broadly categorized into two major types based on their underlying pathology: ischemic and hemorrhagic. Ischemic strokes are the most common, resulting from the blockage of an artery. These can be thrombotic, caused by a local clot, embolic, caused by a traveling clot, or lacunar, affecting small vessels. Hemorrhagic strokes, about 15% of cases, are caused by a ruptured blood vessel. This includes bleeding within the brain tissue, called intracerebral hemorrhage, and bleeding into the subarachnoid space, often from an aneurysm rupture. Understanding risk factors is crucial for prevention. They are divided into non-modifiable and modifiable categories. Non-modifiable risk factors include increasing age, being male, and having a family history of stroke. The most important risk factor to control is hypertension, along with smoking, diabetes, high cholesterol, and atrial fibrillation, or AFib. Recognizing the signs of a stroke quickly is paramount, because time is brain. Symptoms are focal and rapid. Use the FAST acronym. F is for facial drooping, A is for arm weakness, S is for speech difficulty, T means time to call emergency services immediately. Other common symptoms include weakness or paralysis on one side of the body, visual field loss, and balance issues. The first step in management is diagnosis, specifically differentiating between ischemic and hemorrhagic stroke, as treatments are vastly different. The non-contrast CT scan is the gold standard initial test. It quickly identifies a hemorrhagic stroke, which appears bright, allowing us to rule out bleeding before starting clot-busting treatments. Further tests like MRI are more sensitive for early ischemia. Carotid Doppler and echocardiograms help locate the source of clots. Acute ischemic stroke management is time-dependent and focused on rapidly restoring blood flow to the affected brain area. Thrombolysis, using the clot-busting drug TPA, can be given if the patient arrives within a short therapeutic window, usually 3 to 4.5 hours, and has no contraindications. For large vessel occlusion, mechanical thrombectomy, which is the removal of the clot with a catheter, can be performed. Antiplatelet therapy like aspirin is usually started within 48 hours. The treatment for hemorrhagic stroke is centered around stopping the bleeding and protecting the brain from secondary injury. Key goals include strictly controlling blood pressure, reversing any anticoagulation medication the patient may be on, and carefully managing intracranial pressure. Depending on the cause and severity, surgical intervention may be required, such as clipping an aneurysm or evacuating a large hematoma to relieve pressure. Thank you for watching. Remember that prevention, through managing modifiable risk factors like hypertension and AFib, is the best strategy against stroke.